Chamber. It's our privilege to have our Waterbury Chamber Healthcare Council Annual Awards event. This is our 15th annual year that we have been presenting awards to promote excellence in healthcare in the greater Waterbury community. And even during this pandemic, we are so proud to honor people in our region who have really exemplified excellence in healthcare. As we continue this morning, you're going to see the companies who are sponsoring today's event. We are so grateful to them. As you can see on our screen today, our sponsors are our silver sponsor, Naugatuck Valley Radiology. Our gold sponsor is Waterbury Hospital, and our platinum sponsors, we are so grateful for, is St. Mary's Health System and the Perfect Promotion. And we're going to be hearing from our top platinum sponsors in just a moment. I'm so pleased to have Dr. Steve Schneider on the event with us this morning. And first, we're going to hear some brief remarks from Dr. Schneider. I think Doctor is going to be joining us.
I unmuted myself, and
here you are, Doctor. Thank you.
Like everything else this crazy year, it's kind of a weird way to be having this celebration of our healthcare folks, but nonetheless, here we are without breakfast, sadly, but otherwise we're good. So I just want to say that again, we're very appreciative of everything that the Chamber does for the community. We feel very much like the success of St. Mary's Hospital is very much a part of the entire community and the success of the entire community. And we are much stronger and better together than we are working in our separate silos, and the Chamber really accomplishes that for us. So we're very pleased to be a part of this and very pleased to be a sponsor. So thank you.
Thank you, Doctor, and thank you to your whole team there. I see you have some of your team members with you, and we're so honored to have your support, not only with today's event, but throughout the year. You are a member of our board of directors, and several people on your team are involved with our organization, and we really value and appreciate your support. The Perfect Promotion is a Chamber member, and they are also a sponsor with us today. And we're so pleased to have the owner of Perfect Promotion here with us today. And we'd like to give Jody Farrar an opportunity to say a few words. Jody?
Thank you, Lynn. Can you hear me?
Yes, we can.
All right. I'm sorry. I don't know why my video isn't working, so I apologize. But I'm thrilled to be here. I want to congratulate all of the honorees. I believe that our health is truly the most important thing, and without it, nothing else matters. So to all of you here today that work to make people's lives better through better health, we at the Perfect Promotion thank you. Being in the branded merchandise business, if we were all together in person, we'd be giving you lots of goodies. So if anybody would like to receive a goodie bag, please email me at Jody, Jody, at theperfectpromotion.net. Now let's get back to honoring our healthcare heroes, and I hope you all enjoy the event.
Thank you so much, Jody. And again, we really appreciate the contribution the Perfect Promotion has made to the Chamber to honor today's very worthy recipients. As we continue this morning, you're going to be hearing from our chairman of our Healthcare Council. Jason Van Stone is with Opticare Eye Health Centers. Jason has led our Healthcare Council for the last couple of years, and he is a terrific leader in our organization. Okay. Jason's also a member of the Waterbury Board of Education, and we're always so pleased to hear from Jason. And I'm going to turn the program over to Jason right now. Thanks, Jason.
Thank you, Lynn, for those kind words. I appreciate it. And thank you, everyone.
Oh, Jason just got muted.
Oh, I am back.
Okay.
People usually like me to shut up. It's not usually that quickly, though. So welcome again, everyone who's joining us today. I appreciate it. Thank you again to Lynn for introducing me. I'm very, it's always been my pleasure to serve as the chairman of the Healthcare Council Board of Directors. And I'm grateful for the Chamber for that opportunity. I'd like to take a quick second to thank my vice chairwoman of the Healthcare Council Board, Christy Balciano of Easter Seals of Greater Waterbury. She's been my right-hand woman for a couple years now, and I appreciate that. And I'd also like to thank all the other members of the board for their commitment and hard work all year long. It's been a different year, highly unusual for the people in healthcare, and it makes it especially difficult to single out individual honorees when so many in the healthcare field in so many different settings have really risen to the challenge presented by the COVID-19 crisis. While the public may be experiencing a renewed respect for healthcare workers, us on the Healthcare Council have known and appreciated your value for many, many years. Today's honorees would stand out in any year, but given the current environment, their selections in 2020 make it even more special. So on behalf of myself and the Healthcare Council Board of Directors, I congratulate each of our honorees. The Healthcare Council is proud to recognize this year's 4 exceptional honorees, all of whom have contributed to our region's healthcare in their own way. We'll begin with the 2020 Leadership Award. This award is presented annually to an individual from the healthcare profession who embodies the qualities required to improve healthcare in our community. By raising awareness, initiating change, enhancing quality of care, and creating new services, the recipient has demonstrated the vision and foresight needed to create a healthier future for all of us. Today, we present this honor to Dr. Justin Lundbye. Dr. Lundbye is the Chief Medical Officer of Waterbury Hospital, and as the Chief Medical Officer, he leads the clinical, organizational, and logistical healthcare delivery at Waterbury Hospital, evaluating and reassessing staff at all levels and redeploying staff members to meet the needs of critical patients. During the pandemic, he was instrumental in setting the policies to protect patients, visitors, and all hospital employees, guiding the facility through tremendous change to meet the needs of COVID-19 and its patients. Dr. Lundbye also worked tirelessly to establish a drive-through sampling station in record time, at the time making Waterbury Hospital only the 2nd such site in the state. The drive-through had served the community throughout the pandemic, including through dire supply shortages and lab capacity issues. The leadership throughout the pandemic extended beyond the medical staff, but to all hospital employees, into the efforts that went beyond his traditional role, whether it be helping to ensure the hospital had personal protective equipment for all employees and medicine and equipment for all the patients, or lab testing capacity and supplies to continue to best serve the public. Therefore, by leading by example in Waterbury, it is our pleasure to present Dr. Justin Lundbye with the Healthcare Council's 2020 Leadership Award. Congratulations, Dr. Lundbye.
Thank you very much. Get a virtual clap. So thank you. I'm going to be very short, but I want to start by saying that since joining Waterbury Health almost 4 years ago now, I've been very fortunate to work in such a great community with such a wonderful group of people, employees, clinical staff, and it's made my job a joy every day. And now to be selected as the recipient of the Waterbury Regional Chamber Healthcare Council's 2020 Leadership Award is an honor and a privilege. So thank you to the Chamber and also to the Healthcare Council. I'm truly honored to receive this award. I do also want to recognize and congratulate the other recipients of the Chamber's Awards. It's humbling for me to be a part of their success. Next, I do want to point out that the COVID pandemic that we all have been challenged with is a once in a lifetime experience that demanded immediate action and collaboration between different healthcare providers and local and federal government. The work and collaboration that was done by Waterbury Hospital, by its medical staff, by its nurses, by its ancillary and non-clinical staff, in my opinion, was second to none, and thus making this job that I had to get through as a physician leader during the pandemic achievable. Therefore, I really want to give a shout out to all of them for their hard work that they've done. Additionally, the work that was done between Waterbury Hospital and the city of Waterbury and the state government was extraordinary. People worked tirelessly to protect our patients, our families, and our community. Again, humbling to be a part of that. Lastly, I do want to thank the local EMS, the local police department, the local fire department, and the local businesses that have helped support Waterbury Health through this very, very trying time. Again, thank you very much for choosing me for this award. I am so honored and I greatly appreciate it.
Thank you, Dr. Lundbye, for everything you and the hospital did for not only these past 6 months or so, but for all your time here in Waterbury. Really appreciate it.
Thank you.
Our next honor this morning is the 2020 Unsung Hero Award. We present this award to a healthcare practitioner who has distinguished him or herself by providing exceptional care, showing compassion, and a commitment in his or her daily work. This person is dedicated to working behind the scenes while still making a difference in the lives of people they served. Few people exemplify this award better than Trician Salmon. Trician is a licensed practical nurse and a memory care director for Benchmark Senior Living in the village of East Farms in Waterbury. She oversees the care provided to the residents of the village's Harbor Care Apartments, which serve for those with severe dementia and memory impairment. She was selected for her ongoing efforts to ensure that each resident receives the physical, mental, and emotional support needed, and for going above and beyond to create a family atmosphere for both patients as well as staff. Heather Musante Mitchell, Director of the Community Relations for the Village at East Farms, says that Trician is a nurse and is always willing to step in and when she is needed to put on full personal protective equipment to help with the nursing staff when a member is out sick or unavailable. Trician personally greets every resident when they move in and ensures that they are engaged with a variety of activities available at the harbor. Heather also noted a recent incident involving a resident who had contracted COVID-19 and was feared to be near death. The family didn't want the resident to pass alone in a hospital, and Trician arranged to bring him back to the harbor and to provide him with the highest level of care. As a result of her concern and compassion, as well as the work of the harbor staff, this resident is improving every day, and the family is incredibly grateful for all of her efforts. So please join me in honoring our 2020 Unsung Hero, Trician Salmon. Trician, congratulations.
Thank you. I'd like to thank, first of all, God for giving me the ability to care for people in assisted living, memory care, throughout healthcare. Next, I'd like to thank the Chamber of Commerce for this awesome award. My staff at the harbor, the Village of East Farms, my coworkers, everyone that I work with. I really couldn't get through this pandemic without each and every one. Everyone played a major role in everything we did. Next, I'd like to thank my company, Benchmark Assisted Living, for everything they have done for me, moving me through the line and always doing what's best for our residents and our staff. Made it much easier when the company that you work for believes in you and does what's best for everyone. There's so many other people that could have gotten this award, and I'm so grateful. I feel selfish. I don't know why, because I know that every single person at the Village of East Farm worked so hard and pulled it all together. But again, I thank you guys, and I am like taken back by this award.
Congratulations again, it was well earned.
Thank you.
Our third award this morning is the 2020 Stephen Sasala Health Advocate Award, which is presented to an individual organization outside of the healthcare industry who demonstrates exceptional commitment to healthcare-related issues. Using his or her own unique capabilities and competencies, the honoree has demonstrated an ability to improve healthcare and positively influence health-related issues. Today, we present this honor to Jack Birtwell. Jack is the owner and president of Preston Incorporated of Waterbury. Preston manufactures window treatments, including blinds and shades. But in March, Jack decided to begin manufacturing plastic face shields for healthcare workers and first responders. He made this decision after a conversation with a relative who leads an emergency department in a hospital in Virginia. During that conversation, the relative told Jack that they desperately needed personal protective equipment. Ramping up quickly, Preston had produced thousands of face shields and provided them at no charge to hospitals and first responders in our region and throughout Connecticut, as well as other medical facilities and first responders outside of the state. The company continues to innovate in this way, recently beginning to produce plastic shields to protect desks in offices. So please join me today in congratulating Jack Birtwell, the recipient of our 2020 Stephen Sasala Health Advocate Award. Congratulations, Jack. I think you might be muted, Jack.
Okay. All right, that should do it. Well, thank you for all those kind words. But I tell you, before I start talking about what we did, I just got to thank the Chamber for all the good advice and leadership they provided us and many, many other companies through this, this most unusual situation we've been going through. Because we're going for PPP and all these things and loan forgiveness. And it became where I'd talk with my bookkeeper and she'd just say, oops. Oh, let me just turn my speakers down. Sorry, that might be me. That's an alarm system in the house. I'm sorry. One of the door sensors messed up yesterday. I thought I fixed it. I apologize for that. But so one thing, when Michelle would come up to me, our bookkeeper, and we said, well, what are we going to do? She says, I'll call the Chamber. They got to figure it out for us. And they did throughout this whole situation, which was just incredible leadership and good advice throughout the whole time. But also, who really rose to the challenge of this whole thing was all the people that work at Port of Preston. Because here we were all of a sudden laying people off, funded by PPP, rehiring them, but most of our customers were closed. And so we tried to figure out, well, what are we going to do? Let's keep people busy, and what can we do that maybe would help? And I felt like we were just doing just kind of minor, small thing, but we got a lot of our little piece of protective equipment to quite a few, particularly small companies. As the supply chain started filling, there's a lot of people that just weren't seeming to get what they needed. And so, we did it. And I'm glad we did. And I'm glad, this thing, we seem to be beating it, at least in Connecticut. And it's still going to be a tough road. But anyway, thank you to the Chamber, and thank you to everyone from Port of Preston who helped make this happen.
Thank you again, Jack, for everyone, everyone at the company. You really stepped up at a time when we needed everyone to step up. So we can't thank you enough, and congratulations once again.
Thank you all.
Our final honor today is the 2020 Award for Organizational Excellence, which is presented to an organization that demonstrates the best qualities of a healthcare provider. Through exceptional commitment to safety, quality, positive outcomes, and compassionate care, it exemplifies the ideals that embody excellence in everything it does. St. Mary's Hospital certainly qualifies. As part of Trinity Health of New England, St. Mary's Hospital is being honored today for its outstanding efforts in providing healthcare to the region, both before and during the pandemic. The hospital attained a 4-star rating from the Centers of Medicare and Medicaid Services, making it just one of 7 hospitals in the state to receive such a rating, recognizing its quality of care, safety, and patient satisfaction. Over the past several years, St. Mary's has also added 5 urgent care centers and grown its network of primary care, specialty care, and subspecialists. During the pandemic, St. Mary's offered drive-through testing to the entire community without requiring a doctor's note, and partnered with the city to provide free walk-up testing in neighborhoods where residents may not have had access to transportation. It also established a fever upper respiratory unit, or Fury Clinic, to keep patients with those symptoms out of emergency rooms and doctor's offices, helping to limit the spread of COVID-19. It is therefore my great honor to present St. Mary's Hospital with our 2020 Organizational Excellence Award. Accepting the award on behalf of St. Mary's is President and CEO, Dr. Stephen Schneider. Dr. Schneider?
Thank you very much, Jason. It's a pleasure to be honored in this way. It truly was a team effort. If you could have seen the spirit and the esprit de corps that occurred here, where people ignored their own fears and concerns, many of our nurses, doctors, the housekeepers, pretty much everybody that makes this place run had concerns for their own personal well-being. Some of them actually wound up living in dormitory situations generously made available by other members of the community and other members of the chamber. But the most important lesson I think we all learned from this last several months going through COVID is how much we truly are part of the community of Waterbury. It was not a solo hospital effort. Even with the 2 hospitals, we had citizens coming out here pretty much every day of the week, either singing, praying, marching bands, recognitions by first responders, police, fire, EMS, and it was a very much reciprocal give and take sort of experience. The probably 50,000 pounds of food delivered to our employees by restaurateurs and other folks in the community who just wanted to be part of things and wanted to help. We had a great leadership from the mayor and his team. And I think what it really showed is what we can all do together as a community in Waterbury. And more than ever, it kind of justified in my mind that St. Mary's is truly a member and a part of this community. And I could not be prouder of us at St. Mary's, of all of the other healthcare organizations in the community working together, and just the citizenry of Waterbury who showed what kind of a true spirit they have. One last thing I would note is that we were overjoyed when we gradually went from a high of about 88 patients in the hospital, many of them in critical care with COVID-19, and that slowly tapered down to where we actually had almost a week and a half where there were 0 COVID patients. Now we're starting to see a little bit of an uptick again. So in the face of us all feeling really good about how we've worked together as a community, I think there's still a cautionary note that we have to still be vigilant and careful and continue to do the things that we did to make Connecticut as a whole a leader in getting control of the virus. So we look forward to continuing to be part of the community and being a stalwart citizen together with everybody else. So thank you.
Thank you, Dr. Schneider. It was a collaborative effort, and we really do appreciate your leadership and the hospital's leadership during such unprecedented times. This is the point of the process where I was going to introduce our keynote speaker. I think we're having a couple issues getting him on. So I'm going to toss it back to our fearless leader, Lynn Ward, to take us home. Lynn?
Thanks, Jason, and congratulations to the 4 exceptional award winners this morning. As we wait for Dr. Hotez to join us, and I believe he's going to be here momentarily, I'd just like to call your attention to a recording that we have on the Chamber's website. You'll find a link to a recording of an expert panel event that we held recently. In fact, Dr. Lundbye was one of the panelists on that panel, and they talked about the current situation with the pandemic here locally. And the 3 hospitals that were represented was Waterbury Hospital, St. Mary's Hospital, and Midstate Medical. So if you have any interest in going back and taking a look at that recording, you could find that on waterburychamber.com. Also, there's a digital program booklet of today's event, and you could find a link to that in the Zoom notice that you used to join us this morning here. So you could read more about the award winners and see the sponsors again that are with us. The public policy at our chamber is very important, and our Director of Public Policy and Economic Development is Dave Kraszewski. Dave is on the event with us this morning, and he's just going to give you a brief update about some current happenings in public policy as we await Dr. Hotez's arrival.
Thank you, Lynn. Probably the biggest thing to talk about that would be of interest to folks on the Healthcare Council is Governor Lamont's latest executive order, which came recently, and it extended the presumption that anyone who contracts the virus at work who is an essential worker would be given the presumption that they contracted it at work so they could receive workers' compensation. And I see that Dr. Hotez just joined us, so I won't say too much more about that. I'm sure you've heard all about that. We did send out a public policy alert about it. If you have any more questions, I'd be happy to answer it. But I think you'd rather much listen to Peter Hotez than you listen to me.
So let's turn it back to Jason, who is going to introduce our very notable keynote speaker. Thanks, Jason.
Thank you, Lynn. It is now indeed my honor to introduce tonight's keynote speaker. As we all know, as we continue to deal with this wide-ranging effects of COVID-19, it is therefore, again, my privilege to have us today, Dr. Peter J. Hotez, one of the world's foremost experts on viruses and on vaccines. A Connecticut native, Dr. Hotez now serves as the Dean of the National School of Tropical Medicine at Baylor College of Medicine in Houston, Texas. He's also the Endowed Chair in Tropical Pediatrics at Texas Children's Hospital and the co-director of the Texas Children's Hospital Center for Vaccine Development. You've probably seen Dr. Hotez speak as an expert on many of number of major network as well as cable television programs, or very likely you've read his comments in some major national newspapers. If there is a silver lining for our chamber during this horrible pandemic, it is it allowed us to get Dr. Hotez to join us today as our keynote speaker. And he was agreed to answer some of your questions after he finishes his presentation. So I'll get out of your way without any further ado. Please welcome Dr. Peter Hotez. Doctor?
Hello, well, thanks so much for that generous introduction. And it's great to address everybody from Connecticut. I don't know if you mentioned the fact that I was born in Hartford, Connecticut, and grew up in West Hartford, Connecticut, and lifelong friend of Dave Krzyzewski. So it's a real honor to be part of this. You know, what we're seeing right now with COVID-19, and I think what I will do, if this is okay, is to speak for a few minutes, and then we'll leave lots of time for questions, because I'm sure there are a lot of questions from the audience. You know, what we've seen over the last few weeks has been fairly troubling. We've seen a steep resurgence in the number of COVID cases and unfortunately COVID deaths happening over since June, in part because we probably reopened many parts of the country prematurely, number one, without having the adequate public health infrastructure in place. So what we've seen now is a steep acceleration, sort of plateauing now in the southern United States. The problem is it's plateauing at 100 miles an hour. So although you heard, for instance, Dr. Deborah Burks talk about how things have plateaued, yes, it's plateaued, but at an extremely high level. Let me give you an example. Here in Houston, Texas, we were having between 1,200 and 1,500 new cases a day. And those are confirmed cases, which generally means the real number, because of we're still, you know, not completely testing as much as we should. The real number is probably around 5,000 or 6,000 new cases a day. And that becomes really problematic because, one, it means hospital admissions are continuing, the deaths are continuing, but also public health control becomes very difficult. It becomes really tough to do testing and contact tracing, identifying all the contacts of 6,000 new cases a day. And that's a polite way of saying it's not possible. We can't do it. So, and without having a vaccine, and we won't have a vaccine until next year, as it is, we're fighting this with one hand tied behind our back. So we really are not in a very good position right now using the current approach to stem or quell this massive COVID-19 epidemic across our southern states, all the way from Florida through Texas into Arizona and California. And it started out, this big resurgence in Arizona, and now the deaths are piling up, and then into Texas. And now we're seeing it in a very steep way in the southeastern states. So Louisiana is getting hit very hard, Mississippi, Alabama. And that's part one. Part two of this, it seems like the epidemic is kind of climbing northward up the Mississippi, following, in a way, the course of the Mississippi. So up into the Mississippi Delta and into western Tennessee and around the Memphis area along the Mississippi. And now it's moving, accelerating into Indiana, Ohio, really the Ohio River Valley, Illinois. And so we're just continuing to not make progress on quelling this epidemic. So currently about 20% of the world's COVID-19 new cases are in the South. And now we're going to have to add on top of this new phase in the Ohio River Valley. So things are not good, and we are losing this COVID-19 battle, and that has a lot of implications for the nation. So we've been hearing from the White House about the importance of opening the schools. The CDC director, Bob Redfield, has talked about the public health importance of schools. And I think everybody on this call gets it, why schools are important. The American Academy of Pediatrics has issued a statement reminding us that not only the educational benefits of in-person classroom education, but also the food security aspects when you have schools in low-income neighborhoods, because they're feeding the kids, also the mental health counseling, so many different dimensions. But my premise is when you have this level of virus transmission going on across the southern states and into the Midwest, it really becomes a non-starter to open schools. It's just a matter of weeks before teachers, staff, bus drivers all start getting sick, and then the whole thing falls apart. So the question is, so rather than just giving a weather report on how terrible things are there positive things that we can suggest? And as many know, I've now put out what I call my October 1 plan to fix this. And the fix does not have a lot of details, and it does not have a lot of details purposefully because I don't want to prescribe exactly what has to be done. But we've basically got to get our whole nation back down to a containment phase. And I've proposed October 1 as the start date. And containment, there are different definitions. Some use 1 new case per million residents per day. We may not have to be that draconian, but really getting transmission down there. And the work required by different states to each get to that point, as long as we all get to that point, varies. So for instance, up in northern New England, Vermont, Maine, New Hampshire, you're not far away already. You're pretty close to it because the amount of transmission is so low. Same in many parts of upstate New York. But in the southern states, we have enormous amount of work to do, Florida, Texas, to really get to that point. And if we do that, though, if we are willing to do that hard work, it does a lot of things for us. It allows us to open schools, colleges. Potentially, we can even have sporting events again with real people in the stands. I don't want to promise that necessarily, but I think it's quite possible we could get there. The frustration I've had, and those of you who've listened to me on the cable news networks, is I can't get the White House to bend. I can't get them to buy into this national strategy. And now since I've issued what I've recommended, Johns Hopkins has issued a report along similar lines, although they provide a lot more detail in the Association of American Medical Colleges. But I think this is where we're going to have to go. I mean, one of the misunderstandings about COVID-19 is we're just going to wait for the vaccine. And I think that's a huge mistake. I don't see a vaccine being made available until next year. And there's different estimates. Tony Fauci says beginning of next year. I don't see a path until we'll have it to the middle of next year. But even then, these vaccines are going to have different levels of their ability to protect against COVID-19. And what do I mean by that? Well, you know, there are vaccines and then there's vaccines. Ideally, you have a vaccine that actually prevents the infection. And then if enough people get vaccinated, you could have herd immunity in order to interrupt transmission. That would be the ideal situation like we have for a measles vaccine currently. But there's a good possibility the first round of vaccines will not be that good and they'll be partially protective. What that means is they'll reduce the severity of illness, but not prevent you from actually getting the infection. And we have precedent for that, sort of like a flu vaccine in a year where there's not a good match between the virus and the vaccine. So it can prevent you from going to the hospital and going into the ICU, which of course is extremely important, but it's not going to interrupt transmission and won't stop the shedding of virus. So practically speaking, that means that even with vaccines available, we're still going to need existing public health control measures like masks, like contact tracing. So they're not going to be replacement technologies or companion technologies. And we're not really hearing that messaging coming out of the White House as well. So the idea just wait for the vaccine is a non-starter. We're going to have to do the hard work now to bring our country back down to containment level. Otherwise, we can't open schools. School teachers won't feel safe. We can't really get to any sense of normalcy in American life until we take this on. And this is kind of the big frustration I've been having. There seems to be an impasse at this point, trying to get the White House to step up and really embark on that very important October 1 plan. Look, my plan is not the only way to go. There are probably others that are equally suitable out there, but we're going to have a nationally led strategy. And what we've had in its place is letting the states kind of figure it out on their own, with the US government providing some critically important backup support, FEMA support, manufacturing support, supply chain management, ventilators, all that sort of stuff. And that's certainly important, but it's a failed strategy allowing the states in the lead. We're going to have to embark on a federally led response. So I don't know how you want to proceed. Maybe I could talk further if you like, or maybe just stop now and use our time to take some questions from the audience, and maybe that would be a more engaging use of my time with you this morning.
Sure, we can definitely do that. So for everyone who is on with us, if you have a question you'd like to submit via the chat feature, if you just go down to the bottom of the screen and click on chat, you should find that and just type your message in and we'll try to answer that. I have prepared some questions just in case, and we haven't had any submitted at the moment. And first, full disclosure, Peter said that he's known me his whole life and I'm a lifelong friend. The truth is, full disclosure, he's my cousin. So yes, nepotism definitely helped in getting him to join us this morning.
And not only that, Dave is my smarter and nicer cousin. As is the whole Krzyzewski side of the family. That's where all the real brains comes from. Well known, so.
Well, I'll be humble, but I won't argue. So, you talk about the vaccines and the potential for a vaccine in January, and I know you have spent a significant amount of time fighting the anti-vaccine movement. And for anyone who has noticed, in the background behind you is your book, Vaccines Did Not Cause Rachel's Autism, which is about your daughter and raising her on the autism spectrum. Once we get, assuming we get a vaccine that is viable, there's going to be some people who are going to fight getting a vaccine and getting vaccinated. So is there a particular percentage of people who need to get vaccinated for the vaccines to really be effective? And what kind of fight do you expect to face when that finally happens?
Yeah, I mean, we've done a modeling study with a group out of City University in New York and found that we published this recently. It's on medRxiv, but it will be published in a real journal soon. And it finds that if you have a vaccine that actually blocks infection, you need a pretty high percentage of the population covered. Maybe not as much as measles, but at least 60–70% of the population getting vaccinated. And the problem there is there's now been two large surveys undertaken, one by Reuters, the other by Associated Press, that finds that about half of Americans won't accept COVID-19 vaccines, even if they're made available. And my premise is this is partly a self-inflicted wound because of the mismessaging coming out of Operation Warp Speed. The anti-vaccine people, other than claiming vaccines cause autism, they claim vaccines are rushed, they're not adequately tested for safety, and there's this conspiratorial relationship between the government and the pharma companies. And unfortunately, the way Operation Warp Speed is operated through their lack of communications, it's fed all of that is fed into the anti-vaccine movement. I don't think the vaccines are being rushed. They are going through phase 3, all through phase 3 clinical trials. We also have a new vaccine that we're accelerating, a low-cost COVID-19 vaccine that we've developed that's now being scaled up and produced in India as a global health COVID-19 vaccine. The problem is the messaging has been terrible. So even though the clinical trials are not being rushed, just by calling it Operation Warp Speed, it gives the impression that that's not the case. And all of the acceleration is through the way we're doing manufacturing, getting multiple vaccine candidates into the clinical pipeline. But we've not had an effective communication strategy. So this has gotten very powerful, and the anti-vaccine movement now has taken on other dimensions. They're now become a full-fledged anti-science movement because they're, especially down here in Texas and across the South, you have them campaigning against masks and contact tracing. They're under this banner of what they call health freedom, which is kind of a fake term, but they use it very effectively. And so we've got a huge issue around communications that we haven't even started to address yet in the country.
Okay. I guess the follow-up question to that is, even when the vaccine is released, the trials are going on now, I guess, but how are we really going to know how effective they are and, how long the vaccine may protect someone?
Well, the durability of protection, that we're probably not going to find out until after the vaccines are licensed. So that's going to be a bit unknown, right? Because the only way to know durability protection is to have people vaccinated for a few years and then see. And so this is very important that even once the vaccines are released, people are going to have to be very mindful and keep in touch with the news, because it may turn out that the vaccines were not as good as we originally thought. We might need, and this is actually not unusual, that vaccines get replaced and that the vaccine delivery system is evolved. So for instance, when we first had the HPV vaccine for cervical cancer and other cancers, or the rotavirus vaccine, or the Haemophilus influenza type B vaccine, the HIB vaccine that our kids get, the first vaccines get replaced oftentimes within a year or two with better and improved vaccines. So it's a very much an iterative process, and the public needs to understand that. And again, this is why it's so essential why we begin a communication strategy around vaccines. And we're not getting that out of Operation Warp Speed. It's just individual academics like myself on CNN or MSNBC, and it's not adequate. We're going to have a better system than that. So I'm pretty confident the vaccines, no vaccine will be released before it's well tested for safety and efficacy, showing that it works. But the first vaccines may not be our best vaccines, that they may get replaced over time.
Okay. We have started to receive some questions via the chat feature. I'll just try to go with them in order. This one is from St. Mary's Hospital here. One of our honorees this morning. Given the current political tide, assuming that a national strategy does not emerge prior to January 2021, what do you project as the outcome in terms of infection prevalence and mortality over the next 6 months?
Yeah, that's a terrible question. It's a fair question, but it's an awful question, and because it's such dire news, right? I mean, we know the projections from the Institute for Health Metrics are 230,000 American deaths by the end of October, roughly 300,000 by the end of the year. And I've had some people say, well, your October 1 plan sounds good, but I've got my November 3rd plan to the election. And I say, well, I got bad news for you. That November 3rd plan is not a November 3rd plan. It's a January 20th plan when the inauguration. And not only that, it's going to take a couple of weeks for them to find the key to the washroom and figure out how to work the microwave in the White House. And it's probably a February 14th plan, a Valentine's Day plan. And by then, the numbers could easily get to be extraordinary in terms of death, and not just death, it's permanent disability, because we're seeing how this virus causes long-standing injury to the lungs, to the vascular system, to the heart. So even though we're getting better at reducing mortality for people on ventilators through a combination of the convalescent plasma therapy, the anticoagulants, the dexamethasone, the remdesivir, we're still producing people with long-standing injury, possibly even permanent injury, neurologic injury. We're seeing cognitive deficits. It's an awful virus. And just to say we're going to wait till the middle of February before we launch a response, it's not going to work. It'll be so destabilizing, and it'll affect Homeland Security. And so, as I see the White House sort of digging their heels in and not really producing that federal response, I tend to be getting a little more strident and on my interviews on TV, and I don't know where it's going to go.
Yeah. And that's an interesting point about the effects of this virus, not just the death rate. One of the questions we have is, how does the death rate for COVID compare to the death rate for the flu? But this virus is vastly different from the flu in the way it affects people and the long-term effects, and not just in the mortality rate, right?
Yeah. Although flu can cause a lot of, people underestimate flu. They don't realize how flu, now we've learned, is associated with heart attack. One of the people why people die from flu is they have heart attacks from the virus. Flu is a bad actor as well. But, the problem with this virus, it has this sort of Janus face to it, this two faces of it. One, there are many who handle the virus perfectly fine, and especially younger individuals, but not always. And then there's the subset who get very sick and have permanent injury and die. So I think quoting a case fatality rate or an overall number is not very helpful. It really depends on the category of individual that you are, and then in some cases you're better off getting COVID-19 than flu. In other cases, you're much worse off getting COVID-19 than flu, and that makes it very complicated to message, and it also makes it easy to provide misinformation. And you've seen a lot of ways to express why COVID-19 is not a problem. A lot of it's coming out of the White House press conferences, and it's very dangerous rhetoric, because the simple truth is, there's certain things you can't hide, like ICU admissions and hospital deaths, and 230,000 deaths by the end of October, or 300,000 deaths by the end of the year. No matter how you look at it, it's awful. A bad flu season, just for comparison, is around 50,000 deaths. So, and even, let's look at, for instance, the 1918 flu pandemic, right, which everybody always kind of uses as a benchmark for how terrible things can get. In the United States, between 1918 and roughly 1921, so although we called it 1918 flu pandemic, when Woodrow Wilson got very sick at the Treaty of Versailles with that 1918 flu, was in the middle of 1919. So it lasts a couple of years. That killed 675,000 Americans. And if we could even be potentially close to that by February, if we just let that go as is.
Okay, well, that's a depressing number to think about.
Yeah.
So we do have another submitted question. It concerns the antibody test. And the question is, they say they heard that it's not been very reliable, with a lot of false positives and false negatives. So the question is asked is, why is it even given then? And I guess the question is both about the antibody test and what tests actually are the most reliable.
Well, there's been a universal problem with all sorts of testing. So the two major types of testing that we've done is a PCR test for active viral infection and the antibody test. The good news is we are getting better. It's very hard to accelerate new diagnostic tests for a brand new pathogen, and doing it in the middle of an epidemic is really tough. The antibody test measures exposure to the virus and an immune response. I think it's getting better. The FDA has done a good job, I think, of weeding out the ones that were inadequate tests. But if you did get tested early on in this epidemic back in March and April, for antibody testing, you may want to get retested now with some of the newer, better quality kits. And not only that, there's been more virus around. So you may, even though you were an antibody negative a few months ago, you may be antibody positive now. And then the question is, what does antibody positive mean? You've heard a lot of press reports that antibody titers wane, and so therefore the virus is not really causing immunity even if you're infected. But I would say that's probably not the case, that most people who have antibodies, even if those antibody titers diminish, they'll still have what we call memory B cells and long-lasting plasma cells. So that's a long way of saying you'll probably still have immunity. And also you might get a good booster effect if and when you get the vaccine too.
Okay. We do have another submitted question from St. Mary's Hospital. The question is, can organized...
By the way, when I was attending at Yale in pediatric infectious disease, I would visit St. Mary's on Waterbury Hospital, and some great people there, and sending my best to everybody in the Waterbury Hospital system.
Excellent. Thank you. So the question is... Yep. The question is, can organized medicine, hospital associations, et cetera, do anything to put pressure on their president and his advisors to adopt a more coherent strategy? You have been a very strong and reassuring presence on TV for many of us. However, it seems easy for the president to dismiss any one or two advisors, even at very senior respected levels. So what can...
Yeah, I would think so. I would think the hospital associations have a lot of political clout, and absolutely, and work through your Office of Government Affairs to make that happen. I think that would be extremely helpful.
Okay. One last
and
question.
Again, you know, it's what I don't understand is it's in the president's best interests. I mean, it's clear that, you know, the current strategy just to let things burn is not working for them. The poll numbers are continuing to drop. I just don't understand it at any level.
Yeah, I agree with you, just because it seems like he doesn't seem to understand that the economy is COVID and COVID is the economy at this point.
Yeah, and now it's Homeland Security. I mean, if people don't feel safe, which you're hearing about that more and more, people are just worried and scared, and especially teachers, that they're going to be asked to do, you know, show up for work and be exposed to the virus. This is not working for anybody.
And that's where I guess our final question will be, because Connecticut still is trying to figure out how to reopen schools safely. And we have actually done a pretty good job in controlling the virus. You have. And I haven't checked the numbers in the last week or two, but when I last looked, Connecticut was certainly one of the better off states. You were willing to make those hard decisions, and that was good leadership in Connecticut. And we have had good, you know, fairly good response in wearing masks and social distancing.
Right.
There's still a lot we don't know about this virus, and especially its impact on children. And I keep seeing new information every day. I saw a report last week that came out that said slightly older children, but still young in age, may be strong carriers of the virus. And what do we really understand about how the virus affects children, and how it affects children then affects the adults that they're around?
Well, the studies, and we still don't have a lot of extensive studies. The one study out of South Korea shows that kids over the age of 10 transmit the virus perfectly well, almost as well as adults do. And now a new study that was published in JAMA Pediatrics shows that even the young kids have lots of virus in their upper airway, which is one of the reasons why it's so easily transmitted. You have all that virus circulating in your mouth and your nose, and so when you're speaking, you release it. You know, little kids don't have that same, what we call tussive force, for coughing that adults do, so maybe they will transmit it less, but it's still, I think, going to be substantial. And remember how these schools work. Schools are not hermetically sealed, right? I mean, you have parents going in and out of the schools, you have the vendors going in and out of the schools, you have bus drivers using the bathrooms. I mean, this is, you can't, it's not going to be like the NBA in Orlando right now. It's people are going to be going in and out, and teachers will get sick in areas where there's high community transmission. Now in Connecticut, things may be better, and they may have gotten down to the point where they can open schools, but certainly not in many parts of Texas or Florida right now.
Okay, well, we don't have any, we do have one more submitted question. What's your advice to people in states like ours that are doing well and maybe growing more comfortable and, maybe getting a little bit lax about masks and social distancing?
Yeah, I mean, what the masks do, and we don't exactly know what masks do. I think what the masks do is they prevent virus cases from going back up. I don't know how effective they are bringing it down. So this is a big discussion we're having now in Texas, because the number of cases has plateaued, but it's plateaued at 100 miles an hour. We have 6,000 new cases a day. It's not going up, and maybe the masks are preventing it from going up. And I think that's why you need to have that public health messaging in Connecticut. If you can, maintain social distancing, keep your masks on, that could prevent you from having a big resurgence. And that's the hope, and that's where you need the public health messaging.
Excellent. Well, that's all we basically have time for. So at this point, we don't have any more questions. So I will take this opportunity, Peter, to thank you for joining us this morning. I know how busy you've been. You're everywhere. And I know, you're in Houston, so you're on a little bit earlier schedule than we are, but we still appreciate you taking the time to join us and providing your insight today.
Well, thank you so much. Yeah, no, it's been a really interesting time. The problem with all the public communication is I still have my day job and I still have to keep the grants going in the papers, and we're trying to accelerate our vaccine. We might have an announcement this week, maybe next week, about producing it for India and look some other countries as well. So this is an exciting time, and thank you, Dave, for having me. Love to everyone in Connecticut and in Waterbury, and love to your family.
Thank you, Peter. I also have to acknowledge one of our board members is on the meeting this morning. It's Dr. William J. Pizzuto, who is the director of UConn Waterbury. So thanks, Bill, for joining us. And at this time, we want to congratulate again all 4 of our honorees, and also thank all of our sponsors for this morning. That's our platinum sponsors, St. Mary's Hospital and the Perfect Promotion, our gold sponsor, Waterbury Hospital, and our silver sponsor, Norfolk Valley Radiology. So thanks also to everyone who joined us on this meeting this morning. We appreciate you being here. And thanks, everybody. Have a great day.